Namaste Vidya, Amisha Ashok. A very good morning to you all. Myself, Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JV'n University. In today's lecture, we will be continuing with the psychiatric disorder. This will be the first part of this session. So let's start with the psychiatric disorders part 1. The chain starts in your thoughts. What are psychiatric disorders? Psychiatric disorders are among the most common human illnesses. The etiology of psychiatric disorders. Psychiatric disorders are multifactorial, that is, they are dependent on many factors. Many factors are responsible for the development of psychiatric factors, with a combination of biological, psychological, and social causes. So, it is a combination of biological, psychological, and social causes. The biological factors includes the genetic factor and the brain structure and function. So the biological factors includes two things: genetic factors and brain structures and functions. Psychological and behavioral factors includes perceived stress and trauma, the personality and the behavior of the individual, which is responsible for developing various kind of psychiatric disorders. The social and environmental factors, which includes the social isolation and various kind of stress factors that are responsible for the development of psychiatric disorders. Now, what are the various etiological factors which are leading to the development of various psychiatric disorders in human beings? There are certain predisposing factors. Predisposing factors means which predispose the given condition or which occur previous to the given condition. So, increased susceptibility to psychiatric disorders. So, if a person is more susceptible for developing a psychiatric disorder, then that will be the predisposing factor established in utero in childhood. This susceptibility is established usually in the while the baby is pregnant in uterus. It operates through the patient lifetime, and these factors operate which are implanted during the uterine life, and these operate throughout the life by two factors: genetic factors, congenital factors, and there are many other factors that are responsible for the development of psychiatric disorders. Now, etiological factors. Etiological factors, previous was predisposing factor, that was the predisposed to the given condition. Now we have precipitating factor, which precipitates or which causes the development of these psychiatric disorders. So, precipitating factors includes triggers and episodes of illness. The precipitating factors consist of various triggers that establishes the episode of illness, and secondly, determine its time of onset. So, the precipitating factor triggers the development of disease and it determines the time of its onset. Usually, trigger can be a stressful life event or acute physical illness that is responsible for the development of various kind of psychiatric disorders. The perpetuating factors are those factors which are responsible for the continuation of the disease condition, like delay recovery from the illness. It includes lack of social support. If a patient is having any psychiatric disorder and the family members are not supporting that individual, that means it lacks the social support. There are chronic physical illnesses. Patient might be suffering from various disorders which can act as a perpetuating cause for continuation of these disease condition. Now, mental state examination. How will you examine the mental state of a patient who is suffering from a psychiatric disorder? The general appearance and behavior. You can look at the general appearance and behavior of an individual. You can look for the speech and mood, how he speaks, what is the mood of the patient, what are the various thoughts of the patient. You can look into the abnormal beliefs and abnormal perceptions. There can be certain abnormal perceptions of patients and also cognitive functions. Now, what are cognitive functions? Cognitive functions consist of four things: the concentration of the individual, how much he is able to concentrate; the orientation, what is the orientation of the patient; and intellectual abilities, how much he is able to understand and respond to the query; and fourth one is memory, how much he can retain inside. So there are four factors which includes the cognitive functions. One is concentration, the other is orientation, intellectual abilities, and fourth one is the memory. Now, one of the disorder in the cases of psychiatric disorder includes anxiety. So, what is anxiety? A normal and often healthier emotion. This is basically emotion. Anxiety is basically emotion that is normal. If it is anxiety is good actually, but if it occurs in the limit, it forces you or it diverts you towards your goal. But if the anxiety grows in such a way that it starts affecting your life, then it becomes a disease condition. Otherwise, it is a healthy thing. So it is an emotion, the normal and often healthier emotion, which can be due to psychological or somatic cause. So there are two causes for the development of anxiety: psychological cause and somatic cause. Psychological symptoms includes apprehension, irritability, worry. There is apprehension in the patient, there is great irritability, worry, the fear of impending disaster. Something is going to happen, something bad is going to happen. Poor concentration, the patient is not able to concentrate properly, and depersonalization. Now there are various somatic signs and symptoms which tells you about the anxiety of the patient. Palpitations, दिल की धड़कन तेज हो जाती है तब तक, that is palpitation. Fatigue, थकान महसूस होती है. There are great tremors, हाथ पैर कांपने लगते हैं. Dizziness is there. Great sweating, पसीना पसीना आ जाता है, and there is great diarrhea and frequent desire to pass. These are the various somatic symptoms of anxiety. Palpitation, fatigue, tremors, dizziness, sweating, diarrhea, and frequent desire to pass. Other symptoms of the anxiety include chest pain and initial insomnia. Initially, the patient complains of insomnia, that is sleeplessness, and then there is breathlessness and headache. Another condition is depressed mood. The first one was anxiety. Now we have depressed mood. Now, what is depressed mood or the depression? Depressive disorder is common. आजकल आप सुनेंगे हर एक पेशेंट बोलता है मैं डिप्रेशन में हूँ, मुझे परेशान मत करो, मैं डिप्रेस्ड हूँ. So what is depressed mood? Depressive disorder is common. The symptoms of depression are both mental and physical. So the symptoms of depression, ये अभी ध्यान रखिएगा, आगे भी काम आएगा ये ना. So these contain both mental and physical symptoms. The psychological or the mental symptom consist of depressed mood, reduced self-esteem, pessimism, हर चीज को नेगेटिव वे में लेके जाता है. गिल्ट, there's a great feeling of guilt in the patient of depression. मुझे ये करना चाहिए था, मैंने क्यों नहीं किया. There is loss of interest in his studies or the job that the patient is doing. Loss of enjoyment, that is known as anhedonia. This we have already discussed in the last lecture. There is suicidal thinking. The patient is always thinks about a suicide, like or a bank. Now, in the depressed mood, there are various physical symptoms that are the somatic symptoms, which includes reduced appetite. The patient has no desire to eat when he is depressed. But both of the things can occur. There can be no desire to eat, and there can be excessive eating. The patient doesn't recognize when his stomach is full, and he keeps on eating. Weight change occurs, either weight loss, excessive weight loss, or excessive weight gain. There can be disturbed sleep. The patient cannot sleep properly. There is fatigue. There is loss of libido, that is sexual drive. And there are various bowel disturbances. The patient can be constipated or can have diarrhea. There are various motor retardations, that is slowing of an activity. Now, opposite to the depressed mood, there is elated mood. Elated mood when the patient is very much happier, when बहुत ज़्यादा खुश हो जाता है, बहुत ज़्यादा active हो जाता है. So, elation or euphoria. Euphoria is excessive happiness. Is a converse of depression. It is just opposite of the depression, and is characteristic of mania. So, in elated mood, mania can occur. It is manifested as infectious joviality, overactivity. The patient becomes very much hyper. He is very happy and he becomes very overactive. There is lack of sleep and appetite. So, lack of sleep and appetite occurs in depression also and in elation mood also. But you can easily identify the patient when he is in depression or in the elated mood. Undue optimism. The patient becomes undue optimistic that yes, I can do it, and that result into the harm of that particular individual. Over talkativeness. The patient becomes over talkative, excessive talkativeness. There is great irritability. The patient becomes extremely irritable, and there is recklessness in spending. The patient becomes very much reckless in spending, and he just throw away his money. And also reckless in the sexual behavior, when he will have sexual contact with multiple people at a time. So this is all related to the elated mood. So this was all about psychiatric disorders part 1. In the next topic, we will be talking about some more disorders of the psychiatric in psychiatric disorders part 2. So this session was powered by Digital version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with the digital session. If you have any query, please mention it in the comment box. I'll try to resolve. So this was all for today. Thank you very much. We'll meet in the next session tomorrow.